So let's talk a little bit about being an advocate for cancer care. What does that mean to you? And how you move forward now in the advocacy space?
For me, I would say the advocacy care for me right now is like medicine to me. It is healing to me because um, when I started this journey, I didn't know anything. I didn't have anyone to talk to. It was a time that was too scared even mentioning the word cancer. So it is a journey, I can say, has been a lonely journey because even if you have family, there are things you're not able to talk to, there are questions you're not able to ask. And even if they say they understand, they truly don't understand because until you've been in that shoe, then you might not understand fully what someone is going through. So for me, advocacy, it's just working with that person, um, at least being there to answer some of the questions, and those that I don't have answers, we look for them together. Just being there to listen. I don't have to talk, just to listen when they talk, when they say how they feel, and just letting them know it gets better because I have been there. I have worn that shoe, and I think that is one of the most amazing things. That is one of the things that makes me want to wake up tomorrow, just walking with someone, one person, that one smile. Yes.
Now you work a lot with youth, correct? Younger people.
Actually, I started with children, but now the children have become teenagers and now young adults. It's the same group from
Yeah.
childhood. Because why I choose them, it's because one, I was diagnosed as a young adult, and there was no one I knew at that age going through that. Secondly, it's because I found hope from a child that was battling cancer who made me embrace the journey. And secondly, because I also have a child and I have a teenager, a young adult. So all these things, it's like, let me say, generally, my heart beats for that group because it is a group I have been. It's a group that have been so close to my heart because even for treatment, like now, I used to go for, when I go for support group, you would see parents of the children are the ones coming for the support group. But what about this child? He or she has a chemo pot. He or she is not able to, she is not told what that is, but it's told you do treatment, you'll get better. But it doesn't get better within 3 days, 1 year sometimes. And this child has questions. So I choose children so that I can be able to talk to them in the way they can understand. I'll tell them about why you have the headache, why you're vomiting when you do this medication in a language they can understand. Where a lot of people don't have time to tell the children, but their parents. But even these children needs to know what is really happening. How long will they go through this? What are the expectations? What should they expect? And how long will they not be in school at some point? So that is why I chose that group. And then for the young adults, it's because at some point from my experience, after this journey, it's hard for someone to offer you a job. One, because they're scared you might get unwell in their workplaces and their insurances and they have to pay money. The next one, it's like they don't want, I don't know whether it is feeling sorry or just don't want to overburden you. So you find a lot of young people that I've also met, walked the journey with, but at some point they even get to a point to commit suicide because they feel left out. They feel like they don't deserve to be here because they can't even work, they can't stay in their parents. So I think that is one of the things that with what I do, my hope is that when it gets better and bigger, we can also be able to have something like something hope beyond the hospital. You support this teenage person maybe with an income generating activity they can do. There are some who want to do nails. You buy a machine and at least they can have their own, they can make their own businesses. So
Mhm.
yes, that is where my heart is. And those
Yeah.
are the,
Oh, I think that's wonderful. I mean, that's a really good point that how when you're going through this, then you get beyond it. Then what, right? Like, well, how do you live your life beyond what you've known for so many years? So I think that's really important. And I think that's amazing that you're able to bring that out and really help people think through that process.
Thank you.
So I would say that's like some of your, you mentioned teaching coping strategies, things like that. And is there other things that you specifically talk to them about, even when they're younger, about coping with this? And I know also talking to parents probably is tough as well, getting them to understand what communication
Yes.
needs to happen.
Yeah, it is really hard. And sometimes for the children, because they are young, they might not even be able to understand. But what we do is we express through art. Draw what pains you, where do you feel, or just something. And then from the drawing, I can tell this is drawn out of pain, or maybe out of fear, or out of love. So now from there, you're able to know how to talk to this child, whether it's a 4-year-old, an 8-year-old, or a 12-year-old. And then for the teenagers, sometimes for the teenagers, some don't want to talk about it. But because of their mental state, we do like a dance or a Zumba and just dance it out. And then from there, you see someone is opening up slowly. Wait, when I was feeling like this, emotionally, I was like this. But so, yeah, just slowly until they are able to open up.
Yeah, that's great. That's great. Do you find, have you had many of those young adults or children that are going through clinical trials, or that are fearful of going through a clinical trial, or is that something they're dealing with a lot, or even the parents?
A lot of people here don't even know what clinical trial is. So this
Right.
is why I want to do this, so I can advocate. Yes, yes.
Yes.
And even if there are some who had it, it's not done here. Actually, I think 2 months ago is when they've started in one of the hospitals. They are doing clinical, sorry, they are doing clinical trial for breast cancer.
In
So
your
maybe
hospital there?
yes, there's a hospital doing clinical trial now for the first time for breast cancer. So I'm really hoping that it continues like this and people can embrace it. But in the meantime, I'll advocate for it and just talk to people willing to listen. And I know people would love to try it because most of them, like the group I am in or the kids that I have, are those that have been given a limited time. That is the group
Yes.
mostly I
Yeah,
deal with. For the teenagers, the young 20s are mostly those that have been given a timeline.
right. Do you find a lot of fear in the group that you can help talk through?
Yes,
Yes.
yes, a lot of it. And because for me, I was not prepared when I was going into it. So I'm also doing my own research and asking questions now that I didn't know I should have asked. So it will be clear for me when I am telling someone about it. It will be easier even when they ask questions.
Right.
Yeah, to try, but we need now the right channels, the right people, and yeah, right answers.
Do you have other people you work with who are doing some of the same work you're doing, or are you kind of leading leading the charge?
Yes, I have a few people, but the problem has been when I get unwell, everything shuts down. So it's been hard now, but I'm now telling them it's not about me, it's about others. Whether I'm here or I'm not, this is something that needs to continue. So I'm
Yes.
trying to build a team. Yeah, I'm just trying to build a team. And my team, again, are champions, the young adults, anyone around, because this is the group you want to grow and also have something that in future can give us income and also support other patients.
Yes.